Hello Brainiacs, and welcome back to my YouTube channel. I'm Professor Emma Bolism, and today I'll be talking to you about everything you need and want to know about embolic strokes. I had heaps of questions about this topic on my last Instagram post, so I thought, why not make a whole video dedicated to this very important topic? Anyway, let's get straight into it. First things first, what even is an embolic stroke? The brain, like all parts of the body, need oxygen which it gets from the blood. A stroke is a medical emergency that occurs when blood flow to the brain is cut off. When brain cells are starved of oxygen, they become damaged. Strokes are put into two categories depending on the problem within the blood vessels providing oxygenated blood to the brain. They can either be caused by a blockage in the blood vessels called an ischemic stroke, or a bleed in the blood vessels called a hemorrhagic stroke. The most common type of stroke is an ischemic stroke, also known as an embolic stroke. Embolic strokes are commonly caused by the buildup of fatty materials in blood vessels. This fatty buildup may lead to a clot which blocks the blood supply to the brain. So what are the risk factors? There are many risk factors that you do have some control over. I'm sure you know most of these already. But it's easy. Stop smoking. Lower your alcohol consumption. Control your blood pressure, manage your cholesterol, stay physically active, improve your diet, and control your blood sugar levels if you have diabetes. When you recognize any symptoms, you need to act fast. Face. Notice if one side of their face is drooping. Arms. Are they able to lift both arms to the same height, or does one drift down? Speech. Ask the patient a question. Do you notice if they are speaking strange or slurring? If you spot any of these signs, it's time to call an ambulance. Facial droop is asymmetry of the face due to this part of the brain being affected. Arm weakness is due to the reduction of muscle strength. This is closely linked with which hemisphere of the brain is being affected, as the right side controls the left of the brain and vice versa. However, both these symptoms are also a consequence of the death of cells due to the reduction of oxygen preventing the production of ATP to create chemical energy. This allows cell to perform to their cellular function and maintain muscle strength. Communication impairment is impacted due to this region of the brain being impacted. Responsive aphasia, also known as Wernicke's aphasia, is when an individual has difficulty understanding written and spoken language.
Alteplase should only be administered once the risk of an intracranial hemorrhage has been cancelled out. As a recombinant tissue plasminogen activator, Alteplase binds to a fibrin in the thrombus and converts plasminogen to plasmin, which leads to local fibrinolysis. Alteplase is an active ingredient and comes as a powder for reconstruction and injection. The recommended dose is to be administered intravenously at 0.9 mg per kilo over 60 minutes, with 10% of the whole dose as a bolus. Alteplase is a time-dependent drug and has a 4.5-hour window from the onset of the stroke. Contraindications for its use include being under the age of 18 years of age or being outside the 4.5-hour window. Intracranial hemorrhages are also a major adverse effect for the use of Alteplase.
Doctors, nurses, radiographers, speech pathologists, social workers and counsellors are all members of the multidisciplinary team, and they play vital roles in providing a stroke victim with care, treatment and support during the acute, recovery and rehabilitation stage. When a patient suffering a stroke first presents to the emergency room, they will be assessed by a triage nurse using physical and history assessments. The triage nurse can recognise signs and symptoms of a stroke by undertaking an A to G assessment and neurological assessment following the Glasgow Coma Scale, a strength test and the AVPU system. The nurse will also ask the patient about their medical history and medications they take to identify any risk factors they may have that cause the stroke. Assessment findings would usually include lowered neurological function, left or right-sided paresis, and a facial droop. The physical assessment is used to first identify the possibility of a stroke occurring, although it is not enough to diagnose. In critical cases, the nursing assessment is performed multiple times depending on the patient's status. The nurse in charge is responsible for monitoring and documenting any concerning changes in regards to their respiratory pattern, pupil size, shape, and level of their consciousness. Their role is highly important in communicating to the doctor signs of deterioration. The initial assessment steers radiologists into the next step as it identifies what medical imaging needs to be undertaken in order to fully diagnose the patient. In the situation of a stroke, the medical imaging used is blood tests, CT scans, and MRI scans. The first imaging undertaken will often be a CT scan, as it only takes a few minutes to complete and can rule out acute hemorrhages and differentiate between viable and deprived tissue. This imaging will be able to completely diagnose the patient with an embolic stroke and able to predict the prognosis and severity of the damage. The radiologist will usually complete an MRI scan on the patient following a CT scan, as it creates a clearer image of the damage, although is more accurate to undertake several days after the first symptoms of stroke occurs. The CT and MRI scans will be interpreted and evaluated by radiologists and medical officers in charge of diagnosing the suffering patient. On presentation to the emergency room, the patient's bloods will be taken immediately to be analysed. The blood test will be analysed later by a medical officer and will show the coagulation and cholesterol status of the patient, which are biomarkers for strokes. The blood test is used to find out underlying causes and to rule out other conditions that mimic stroke symptoms. Although blood tests cannot be used to fully However, blood tests cannot be used to fully diagnose ischemic strokes. Also, taking a blood glucose level of the patient will rule out hypoglycemia, which can often present similar to a stroke patient.
This ad is brought to you by aspirin, an antiplatelet agent used in the treatment and prevention of embolic strokes. It has an ability to inhibit cyclooxygenase in platelets that blocks the formation of thromboxane. By blocking cyclooxygenase, enzyme activity within the platelet cell is inactivated, leading to the stop in the progress that produces thromboxane.
Due to damaged brain tissue, 80% of patients experience motor impairment and numbness. When feeling in their face is lost, one's ability to swallow safely is impacted, which is known as dysphagia. Dysphagia occurs due to the damage of muscles associated with the action of swallowing. All stroke patients need to be assessed by a speech pathologist and undergo a swallowing assessment if deemed necessary. This is to be done within 24 hours of admission, and until then are to remain nil by mouth to ensure no further complications arise. If issues associated with their ability to swallow arise, the patient needs to undergo dysphagia therapy, as these issues can persist for months. Ensuring that the patient is also receiving adequate amounts of water and nutrients daily is important, but because dysphagia can cause secondary complications for the patient, including aspiration pneumonia, chest infections, and respiratory complications, it is vital that their diet is modified and that they are referred to a dietitian if necessary. The impacts of stroke can have a cascading effect, with the ability to alter all body systems and their functions, leaving stroke survivors with disabilities that they may not have had prior to their stroke. The sudden onset of disability can leave the individual, their family and friends underprepared and unknowledgeable on how to cope. Multiple factors influence patient prognosis preceding a stroke, including the area of the affected brain, the extent of damage to their health and physical activity. Therefore, every stroke affects the individual differently, resulting in different patient prognosis. There are three major areas of assistance and care needed by stroke survivors. 64% need assistance with healthcare, 58% need assistance with mobility, and 47% with self-care. Before I wrap up today's video, I'll leave you with a few statistics about embolic strokes. In 2013, strokes accounted for 11.8% of deaths worldwide and was the second leading cause of death globally. Here is my favourite song, so please don't hesitate to sing along.
Jenny and her grandma made on an ordinary day. When there in the kitchen, Grandma started to sway. Grandma sounded strange when she spoke, and Jenny had to ask, what if my grandma's having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is her speech coming out kind of strangely? Then it's time to call
000.
Jack and his favorite friends Hank looked up, half his face drooped down. Hank wasn't making a joke, and so Jack had to ask, what if my buddy is having a stroke? I think I better act fast. I think I better act fast. Does his face look a little bit uneven? Does one arm drift down? Is his speech coming out kinda strangely? Then it's time to call 911.
000.
Helen and Bob were walking at their favorite time of day. Helen turned to Bob and said, my arm is not okay. Her arm was limp inside her coat, and so Bob had to ask, what if Helen is having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is his speech coming out kinda strangely? Then it's time to
000.
Stroke can happen anywhere, morning, noon, or night. And every minute after that, more brain cells die. Our heroes acted quickly, and so they all have hope. Precious time and emergency care. You can beat a stroke. You can beat a stroke. Call fast for any sign of stroke. It's what you gotta do. Call
000.
one you love is depending on you. Someone's depending on you. Someone.
Thank you for watching the video. I'll leave my social media on the screen if you wanted to ask any other questions regarding embolic strokes.
Don't forget to act fast.